So the first thing we did at the beginning of this year of planning was we sat down and looked in detail at the feedback we had from attendees last year. We looked at what they felt worked for them, and building on that we tried to expand that to meet a wider audience. We looked at what didn't work quite so well and minimise that sort of potential. And broadly they told us that they wanted great science, but they didn't want to be bored to death by repeated slides of data. They wanted the science presented in challenging and innovative ways. They wanted the chance to think a bit out the box, look at different subjects that they might need to be considering. So for example, we've had immunologists here thinking about the impact of our treatments on your immune system and how we might focus on addressing that. We've had Dame Sally Davis talking about antimicrobial resistance and being quite challenging about our use of prophylactic antibiotics and how that might threaten the future of our entire service. So a lot of things to think about and encompass in one meeting. So the bedrock of the BSH is really great science, and we set the stage for that in our first session, which opened up with how we save lives by bringing care closer to the patient at the point of injury when they suffer severe trauma, and we save their lives potentially by giving early tranexamic acid, which is a very cheap treatment, but we've not been very good at bringing it forward in the pathway. The second talk was state-of-the-art gene therapy in diseases which have been very neglected, diseases of red cells which affect, for example, minority populations like Afro-Caribbeans and Africans, for example. And the third talk was exploring the biology and the progression of genomic change in cancers. So that was the science that started off the meeting. Following on from that, we've had a breadth of thinking, considering, for example, how we manage disasters, how we respond to disasters, like the Gosport tragedy, where we know that the lives of several people were brought to an untimely end through poor action by one doctor, and more importantly, the failure of the system to act on that situation and turn it around. And then we've had patients presenting their very personal and intimate stories and explaining things to us in a way that will help us develop future treatments which more closely work in partnership with them to understand all of their needs rather than just the small 1% that we're currently tackling.